Okay, well I'm Katherine and I'm from NHS Networks. The whole reason we're here today is because what we've produced is a free service for NHS around health and social care. So people don't have to be in the NHS to use it, but it is around making sure that innovation is being shared, that all the best practice is being shared, that we are making sure that people aren't duplicating stuff and spending money on websites. Our website is free. It's a platform where networks, anybody networking around anything with health and social care can build their own platform, share documents, have discussions, make sure that they are in touch with issues that are important to their group. And we just want to make sure that nobody's spending money on building a website to do that. It's free.
Is the patient and the patients at the centre of everything that you're doing? Or?
Absolutely. We've created it so that anybody can use this site. You don't have to have a clinical background, you don't have to be a professional in the NHS. Patients can use our site to discuss what their issues are. We spoke to a chap this morning who is trying to find out how patients are affected around oxygen supplies and things like that. So he wanted a site where he could create a secure forum for them to share their issues, to tell them what they needed, and that they could sort of speak to them in a sort of open and friendly way, but also to keep that history as well. So these conversations aren't just taking place in a room and then forgotten or noted down in somebody's book. These are actually things that people can see, share, learn from, and network on a much larger scale, which is what Jim Easton is constantly going on about. You know, we need to network on a much larger scale to make sure that we're not spending money that we don't need to spend.
So do you think that NHS is going to move forward with technology and embrace this?
I think so. I mean, I'm not a technical person at all, and I think these simple tools that are being developed at the moment are the way forward, so that people can still get on with their jobs without having to constantly think about, oh, you know, there's this new tool over here that is really difficult to use. The simple stuff like this, I think, is going to make a huge difference, but it has to be done by talking to the people that are using it. So, you know, the healthcare professionals on the front line, and making it completely relevant to what they're doing for the patients. And the more feedback, the more ways that we can get patients to tell us what they think and how it's affecting them, the better.